Good morning, all. Last time, what was the lecture last time? Leprosy. I think we finished leprosy, no? All of it. Any question from that? कुछ समझ नहीं आया या कुछ भी समझ नहीं आया या कुछ याद ही नहीं है कि क्या करवाया था? सब्जेक्ट याद है, लेप्रोसी कराया था। मैं पूछूं? नहीं, आप लोग आते हैं कितने जने? 150 का स्ट्रेंथ है ना आपका। सो आउट ऑफ 150 ओनली 10 स्टूडेंट्स आर देयर। बाकी क्या एग्जाम चल रहे हैं क्या? तो वैसे ही घर बैठे हैं, हॉस्टल में बैठे हैं सब। हाँ, फाइनल ईयर के सब्जेक्ट में ज़्यादा आते हैं। मैच था रात को कोई? अच्छा, ऐसे। तो फाइनल ईयर में थोड़ी लेक्चर्स होंगे वापस से। तो आप जो लेक्चर सिस्टम एक होता है वो एक बार लेक्चर्स होते हैं सारे में, फिर तो आपकी क्लिनिकल पोस्टिंग होगी। क्लिनिकली थ्योरेटिकल नहीं आएगा तो क्लिनिकली क्या करोगे ना? कुछ क्वेश्चंस आते नहीं है क्या आपके? फाइनल में भी स्किन के आते होंगे ना? कुछ भी नहीं आता? आता है, कैसे नहीं आता? हमारे टाइम भी 5 शॉर्ट नोट तो आते थे, 5 में से एक आता था। अब आपके पता नहीं, आपका तो आपका कौन सा बैच है? 19? तो 19 तो न्यूअर सिस्टम है ना आपका। उसी के साथ हम पढ़ा रहे हैं। ये सारे टॉपिक्स आर कवर्ड अंडर द न्यू system. So we are following that system. So about I think 18 topics are there. We are taking lecture accordingly. Okay, leprosy we finished. Basics, we just want you to know what exactly is leprosy, just the basic classification of leprosy and the treatment. Now coming to very important topic, what that is sexually transmitted infections. So these, it was the term before we were using the term STDs. Ds is sexually transmitted diseases. So now it has slightly changed to sexually transmissible or transmitted infections. So there is a lot of difference between sexually transmitted diseases and sexually transmissible infections. So it's just the contact may lead to many types of infections that can be transmitted between the partners. Before it was only the sexual process which was infecting the partner. So there were very few diseases in sexually transmitted diseases. Only 5 important diseases were there. Most important was syphilis, then chancroid, granuloma inguinal, LGV, lymphogranuloma venereum, and herpes, genital herpes. And then came the era of HIV. So now it has been broadly classified into sexually transmitted infections. So any infection that can be transmitted on contact of two partners. So this is all the headings that will go through. So coming to the definition of sexually transmitted infections, these are a group of communicable diseases that are transmitted by sexual contact and caused by a wide variety of bacteria, viral, protozoal, fungal and ectoparasites. So now it is a broad classification. So all communicable diseases that are transmitted by sexual contact. So many diseases now come under this heading. So transformation in STIs. So list of pathogens which are sexually transmitted has expanded from 5 classical venereal disease to include more than 20 agents including the viral infections. So shift to clinical syndromes associated with STIs. So classification of STI agents. So we'll classify according to the various um, agents. So bacterial, viral, fungal, ectoparasites and so on and so forth. So most common that was in STDs was syphilis. So it is caused by, so bacterial infection caused by Treponema pallidum. Then chancroid again is caused by bacteria. It's caused by Haemophilus ducreyi. Then Calmitobacterium granulomatous causes donovanosis, what we call as granuloma inguinal. Bacterial vaginosis, again in females you will find the bacterial infection transmitted through sexual contact is bacterial vaginosis caused by various microbial agents, and Another important, very important STD or STI is gonorrhea. You must have heard about syphilis and gonorrhea. These are the common terms that have been used since long, and it's mm, sexually transmitted diseases since centuries. It is caused by Neisseria gonorrhea, which causes gonococcal urethritis, and there are many other manifestations and complications of Neisseria gonorrhea. Other bacterial agents are Chlamydia trachomatis, which causes non-gonococcal urethritis, Mycoplasma hominis, all these they cause non-gonococcal urethritis. So urethritis basically is divided into two. One is gonococcal, which is the most common, and if we are not able to find the gonococcus or Neisseria gonorrhea, then it becomes non-gonococcal urethritis. And then these are caused by Chlamydia trachomatis, Mycoplasma hominis, and Ureaplasma urolithecum. So these are the agents which causes non-gonococcal urethritis. Now coming to the viral agents of STIs. Now we'll not say STDs, it is STIs. So all sexually transmissible infections or sexually transmitted infections. So viral agents, as I said, the common one is HSV virus 1 and 2, which causes genital herpes, which is the common out of these two, HSV 1 or 2. 2. So 2 is the common one. 1 causes, एक से क्या होता है HSV 1 usually causes, ये हो चुका है हमारा शायद वायरल इन्फेक्शंस वी हैव टेकन अंडर दैट viral infection we discussed other diseases, skin diseases caused by herpes simplex virus. HSV 1 क्या कॉज करता है? आपको एक ही आता है वायरल इन्फेक्शन, दो आते हैं शायद, दो में से एक ही है. एक तो चिकन पॉक्स आता है, एक और आता है कोई आपको ना, किसी को नहीं आता. वायरल इन्फेक्शन हो गया कि स्टिल इट इज वी हैव नॉट टेकन वायरल इन्फेक्शन, स्किन वायरल स्किन डिजीजेस. herpes labialis इज द कॉमनेस्ट. आप ये दो ही चीजें तो आती है आपको, और तो कहाँ कंफ्यूज वो होता है जिसको बहुत सारी डिजीजेस पता होती है कि कौन सा वायरस क्या कर रहा है. तो एक दो पता है आपको, उसको भी भूल जाते हो आप ना. सो herpes labialis is caused by herpes simplex virus 1 mostly. So below the waist, all the infections, viral infections HSV causes are by HSV 2. Above the waist is HSV 1 usually, but both can cause. It's not fixed in dermatology or even medicine. Nothing is 100%. Usually it's a combination, or uh, there may be exceptions in dermatology, or there are so many exceptions in medicine. So usually we say one causes herpes labialis and two causes genital herpes. Then hepatitis B virus can be sexually transmitted. हेपेटाइटिस बी वैक्सीनेशन आप सबका हो गया? क्यों? तो आप लोगों को ऑन एडमिशन हेपेटाइटिस बी नहीं लगाते? लगाते हैं. बताया नहीं कि आपने लगवाया नहीं, कि पूछा ही नहीं आपने? लगाया नहीं, कोविड आ गया था तो लगवाओ ना जाके अपना अच्छे से, हेपेटाइटिस बी तो लगवाओ. जैसे जैसे आपकी क्लिनिकल पोस्टिंग होगी, मे बी यू गेट इन कॉन्टेक्ट विथ हेपेटाइटिस बी पेशेंट, बेटर टू गेट इम्यूनाइज्ड एज सून एज पॉसिबल. हेपेटाइटिस बी के लिए लगवाओ. देन ह्यूमन पेपिलोमा वायरस, द कॉमनेस्ट प्रेजेंटेशन इज वॉट्स. वॉट्स भी आपका हो चुका है. Then molluscum contagiosum virus causes molluscum contagiosum. This all can be sexually transmitted. Touch to touch तो हो ही सकता है. Sexual contact is also a touch. Then immunodeficiency. Human immunodeficiency virus causes AIDS. What is the full form of AIDS? Acquired immunodeficiency. Then protozoal agents causing can be transmitted by sexual contact also. So amoebiasis, then giardiasis and vaginitis. So vaginitis caused by Trichomonas vaginalis we usually see in patients, and these two are uncommon nowadays. Protozoally. And coming to the fungal infection. So candidiasis again can be sexually transmitted. What we call is candidal vaginitis. So candida albicans can be transmitted. Then ectoparasites, both pediculosis and scabies can be transmitted sexually. So this we have already covered. I think pediculosis we have done. What is uh, which type of pediculosis is caused by can be transmitted sexually. पेडिकुलोसिस क्या होता है? नेक्टोपेरेसाइट हिंदी में क्या बोलते हैं हम लोग उसको? कॉमन व्हाट इज द अदर कॉमन टर्म दैट वी यूजुअली यूज फॉर पेडिकुलोसिस? ये तो सबको पता है, इतना बड़ा. हाँ, मेडिसिन इज कंफ्यूजिंग. एक ही चीज के 10-10 नाम रख देते हैं वो लोग ना. क्वेश्चन पेपर में भी कई बार एक चीज आती है जो आपको सब आता भी है बट वो टर्म नहीं आता है इसलिए आप कर नहीं पाते उसको. बोलो गलत होगा और क्या होगा? जो है लाइस, लाइस इन्फेस्टेशन इज पेडिकुलोसिस. तो दैट किसको नहीं पता है, सबको पता है. और अगर एग्जामिनेशन में पेडिकुलोसिस आएगा तो आप अटक जाओगे कि एग्जैक्टली है क्या ये चीज़ में. सो आई थिंक दे शुड कम अप विथ ओनली वन टर्म सो दैट एवरीबडी नोज. यहाँ अभी आप डर्मेटोलॉजी में आओगे तो ईच एंड एवरी डायग्नोसिस है एटलीस्ट 5 to 6 अदर सिनोनिम्स and examiners are happy to give such a word which nobody knows. Student को आते हुए भी वो कर नहीं पाते. So now classification is being revised a bit so that we can include only one term that is read and that everybody knows. Other is scabies, so it's caused by Sarcoptes scabies. Which type of pediculosis can be transmitted sexually? There were 3 types of lice infestation. भूल गए सब कुछ ना, सब लेक्चर हुआ है. बेसिक आपका लेते हैं. कौन सा? Head lice, pediculosis capitis. Other was body lice. Third was the pubic lice. Serous pubis, what we call. So that type of pediculosis can be transmitted sexually. Now coming to the history, general history, context of STD, onset, character, and discharge. So most common complaints in an STDs or STIs are skin ulceration, which is the most common one. Then the urethral discharge is the common one. So dysuria, there may be discharge, dysuria, burning, dyspareunia, pelvic pain, ulcer, lump, rash, and so many varied presentations are there. So history we should elucidate in such patients is obstetric history of abortions. Why history of abortions is important in the case of STIs or STDs? It may lead to abortion, but which one? Which is the commonest one? Scabies will not lead to abortion. Pubic lice will not lead to abortion. Usually in certain STDs, the patient is infected may lead to abortion. The most common one of these is syphilis. So syphilis usually is a long or chronic infection if not treated, and it may lead to abortions in female patients. Any history of injecting drug abuse? What drug? How often? Why we want to get history of injection, especially the drug abuse, or any kind of infection, especially the drug abuse. इससे क्या फर्क पड़ता है हिस्ट्री में? Why we have to take this history in a case of it? Needle sharing. So needle sharing may lead to which type of diseases? कौन से STDs हो सकते हैं needle sharing? HIV can be transmitted. Hepatitis could be transmitted. So it's important. So taking history is very important. Any history of tattooing or blood product exposure. Again, this is similar to the needle exposure. So tattooing से क्या होगा? Tattoo, we get this tattoo done nowadays. इंडिया में भी एक क्रेज हो गया है कि जाके हम टैटू करा रहे हैं सब लोग ना. उससे क्या ट्रांसमिटेड हो सकते हैं इन्फेक्शन? जोर से बोलो, थोड़ा जोर से बोलो. टैटू नीडल स्टरलाइज नहीं किया है तो क्या होगा? HIV हो सकता है, हेपेटाइटिस B हो सकता है. So many infections can be transmitted. So this is very important. हमने वेस्टर्न कल्चर को फॉलो करना तो शुरू कर दिया? आर वी टेकिंग ऑल प्रिकॉशंस? अब आप देख रहे हो कि यहाँ पे tattooing is very common nowadays. What we do in dermatology is we remove tattoos. So laser tattoo removal is being done. So यहाँ अब we are getting so many cases now because people are going for tattoo. पहले बनवा लेते हैं और फिर उनको लगता है कि इसको निकालो, थोड़े दिन मजा आता है, फिर वो दैट इज परमानेंट, समटाइम्स टैटू इज परमानेंट। अब इसको निकालें कैसे? नाम भी किसी किसी का लिखवा लेते हैं, फिर नहीं बनती है तो फिर निकलवाने आते हैं इसको। दैट इज सीरियस इशू। Sexual history. Now, sexual history is important. Number of exposure, single, multiple. So these are the questions that we should ask in a case of STD. Number of sexual partners, last date of sexual exposure, sex partner, history of male to male contact. Why male to male contact is important? क्या होगा मेल टू मेल कॉन्टैक्ट? What all STDs can be transmitted? So homosexuality leads to these types of STDs. HIV is the most common. HIV era में this was the commonest mode of transmission. Type of intercourse, oral, vaginal, anal, unprotected, protected. History for HIV. So three important things are there in HIV. There is recurrent diarrhea. It's a common long history of diarrhea. History of fever, loss of weight, genital ulcer disease, blood transfusion, history of herpes zoster and opportunistic infections is common in HIV. Why? HIV में opportunistic infections क्यों common है? What are opportunistic infections? Candidiasis, aspergillosis. Why they are common? Immunity कम हो जाती है, acquired immunodeficiency syndrome है. So many infections which were not common becomes much more common in these patients. Herpes zoster, another factor, another skin disease which is more common with some sort of immunosuppression. Examination is exposure of the abdomen, genital, thighs is required. Inspect for rashes, lumps, ulcers, discharge. So many things. Complete examination is required. Inspect for pubic hair, for lice and nits. Skin of the face, trunk, forearm, palms and oral mucosa. Palpate for lymph nodes. So usually with STDs there is lymphadenopathy also. So there are various types of lymphadenopathy in cases of sexually transmitted infections. So that we'll discuss with each and every STI. Examination in male is inspection of the penis, external meatus, retracted foreskin, perianal, palpation of scrotum, expression of any discharge from the urethra, lymph node, per rectal examination and proctoscopy. Women we go for inspection of the external genitalia, perineum, perianal area, oral cavity, lymph node examination, speculum examination of vagina, cervix and bimanual pelvic examination. So other systemic examinations have also to be required. Why we are going for systemic examination in a case of sexually transmissible infection? Cardiovascular क्यों देखना है? Respiratory, GI, central nervous, musculoskeletal. बहुत सारी diseases हो सकती हैं. HIV is not it will not just lead to skin infections, herpes zoster or opportunistic. There are so many other systemic diseases or infections which can take place because of immunosuppression. And HIV तो हो गया. Most common is syphilis. So syphilis may lead to cardiovascular syphilis. It may lead to neurosyphilis. So many manifestations of syphilitic bacteria is there. So it may, with time, it may infect most of the organ and it may lead to complications in various systems. So systemic is very important. So coming to the syphilis, which is the common STI and a very old one. So it's centuries syphilis is going on. It is caused by Treponema pallidum and it's a fine motile spiral organism measuring 6 to 20 millimicrons. Regular spirals which help in differentiating from other non-pathogenic treponemes. So that spiral positioning is very important to differentiate from other treponemes. So we have treponemes in our body also which are non-pathogenic. So usually in oral mucosa we have treponemes which are not Treponema pallidum, but they appear to be same. But once we see in the microscope, the spiral characteristic will differentiate from other treponemes, which are non-pathogenic. Transmission moderate to high probability of transmission through sexual contact. Infected blood may transmit. Transplacental route is important, so it is passed down from the mother to the child. Accidental to medical personnel, so syphilitic in sonitum, what we call is transmission of syphilis from person to person during working in a medical sector. So pathogenesis, it leads to infection and attachment to the host cell through sexual contact. Through the corkscrew movement, because of the spiral nature, it travels to the lymph node. In perivascular lymphatics causes endarteritis obliterans. So this is the commonest manifestation of a syphilitic bacteria. It affects the lymphatics of the blood vessels, so which leads to the obstruction of the blood vessels and what we call is endarteritis obliterans. This is loss of blood supply and finally formation of genital ulcer. So because of all this mechanism, this type of this type of infection is, what is the most important characteristic of a syphilitic ulcer? क्या होता है अल्सरेशन जब भी हमें होता है और इस अल्सर में क्या डिफरेंस? इट्स अ पेनलेस अल्सर. Ulceration is there over the genital, but it is painless. The patient only comes to a physician when some pain is there. Otherwise, वो टालता रहता है उसको कि पेन नहीं है ठीक हो जाएगा, पेन नहीं है ठीक हो जाएगा. That leads to, from primary syphilis it goes into secondary syphilis and then tertiary syphilis. It's a long, many stages are there which usually we are not seeing nowadays because of the advent of penicillin or antibiotics. So now people are taking antibiotics for each and everything. Maybe every month or every year, 2 or 3 times, everybody is taking antibiotics. So that has reduced the transmission of syphilis because antibiotics works on this bacteria. So primary syphilis, secondary syphilis, tertiary syphilis, stage from infection to the healing of the chancre is the primary syphilis. Incubation period is, what is the incubation period? So contact and the appearance of signs or symptoms. This is, it's a large incubation period in syphilis. From 9 days, patient can get ulceration. It may take 3 months to get the ulceration. So this is a classical case of syphilis where you'll find a painless ulceration over the genitalia, and on feel it's indurated. So induration is there, which is what we call is button type of induration. What we feel on touching a button, it's similar to that one, and it's painless. So single, it's usually single also. Single, painless, well-defined ulceration, clean-looking granulation tissue. So it's clean, it's not messy or first discharge is not there. It's very clean because of the endarteritis obliterans. There is no blood supply to that region, which leads to ulcer formation, which is painless because of the nerve supply is also not there because of the endarteritis obliterans. So this induration is very important, and other is painless nature of the ulceration. So two things you can differentiate from other types of ulceration. Just you will touch the patient, it's indurated and painless. That means usually a case of syphilis. Hard chancre we call heals with scar even without treatment. So if patient doesn't go for treatment, it usually heals in few weeks. But then it leads to secondary syphilis. So it has not been treated, it will go into the stage of secondary syphilis. Sites most common is genital because of the contact. Extragenital may be there because of other modes of sexual contact. So what all investigations usually it's usually clinically diagnosed. If we see a case hard ulceration indurating without pain, we usually diagnose it as a case of syphilis. For proving the diagnosis, we may go for dark ground illumination. So dark ground illumination is a specific probe that we put in the microscope where we can see the syphilitic bacteria spirals. We can see the movement also. So it's 100% diagnosis once we see in DGI. Then DFA TP is another investigation which proves the diagnosis, and most common that everybody must have heard is VDRL. So VDRL usually is negative initially, but it becomes positive by the 4 weeks of ulceration. So coming to secondary syphilis, once the primary is not treated, the patient ends up into secondary syphilis in 6 to 8 weeks. It's a systemic disease. Now the virus has, bacteria has gone into the system, so it has started infecting systemic, other systems also. There may be constitutional features like sore throat, malaise, fever, joint pain may continue. Common signs are skin rash. So again, you'll find skin rash. Now this is not the skin rash of the contact, which is ulceration. So now this is skin rash which have been disseminated because of the disseminated syphilis. Now this is endogenic. From inside it is coming out. Before it was from external source. There may be lymphadenopathy and may be mucosal lesions also, which are very classical. Usually nowadays we are seeing few patients of secondary syphilis, not many. So cutaneous non-itchy lesions, again these are non-itchy. So usually on the rash, any viral rash or drug rash is usually itchy. But in this, the rash is similar to them, but then it's non-itchy. Macular, papular, nodular, pustular, and so any type of lesion can be. So in a adult youth, any sort of rash should be investigated for syphilis also. Syphilis should be ruled out. Condyloma lata, another term we read before was condyloma acuminata. This is condyloma lata. Acuminata was, what was condyloma acuminata? So these are all synonyms of a simple common disease that everybody knows. But I don't know why they have put such complicated terms, very difficult to pronounce also and difficult to remember also. What is condyloma acuminata? So it's genital warts we call is condyloma acuminata. It's a warts which is caused by, warts किससे होते हैं? हाँ? ह्यूमन पैपिलोमा, HPV वायरस का. अभी बीच में कंफ्यूज हो गया तो नेक्स्ट टाइम लेंगे. ठीक घुस रहा है कुछ. लाटा, condyloma lata, ये जो आ रहा है टर्म. Lata means flat. So you'll find flat lesions in cases of syphilis. Secondary syphilis, there are flat lesions, what we call is condyloma lata. We'll see the pictures. Pictures are most important. इसमें थोड़ा write up ज़्यादा है. Next time we'll put some more pictures so that you'll be able to remember. Split papules at the angle of the mouth, conora veneris. So these are the terms which Rahul must be knowing. Even he is also not knowing. अभी इनका भी शुरू नहीं हुआ है. कितने पेशेंट्स देखे हैं सिफिलिस के ना. Moth-eaten alopecia is there in secondary syphilis, and mucosal lesions include mucosal patches. So this is papules and plaques over genitals and thighs. So this is the case of secondary syphilis. What we get in primary syphilis is, primary में क्या होता है? Ulceration होता है. So genital ulcer is there, that is primary syphilis. Secondary syphilis, there is no ulceration. We are getting papules and plaques and all these things which are, and second is, these are moist erythematous papules and plaques perianally. This is what we call is condyloma lata. These are flat, moist, oozy plaques are there over the genital region. Snail track ulcer over the soft palate, you can see a track of ulceration. Usually in afta or some other ulceration, there is a oral afta is ulceration. Oral ulcerations are at a point. It's not a snail track. So this you will find a track which is. आप तो वहाँ क्यों बैठे हो? दिख रहा है क्या आपको कुछ? दिख रहा है वहाँ से? यहाँ बैठो तो कम से कम कुछ दिखेगा थोड़ा बहुत ना. Second is moist erythematous plaques at the angle of the mouth. So angle of the mouth you can see what is called as angular cheilitis. This type of lesion are all very specific for secondary syphilis. Again annular papules and plaques over the face. Then erythematous tender macules over the palms and the soles. So these are classical for secondary syphilis. So what is the classical sign to diagnose, Rahul? Secondary syphilis. Palms में lesions होंगे तो क्या करोगे? ऐसा तो नहीं, रीजन तो है ना एरियल रीजन, आप कैसे उसको कौन सा टेस्ट करते? पिन प्रिक टेस्ट करते हैं, प्रिक करते हो, फिर प्रिक दैट लीजन फ्रॉम द बैक ऑफ द पिन, आगे से तो सबको दर्द होगा, पीछे का जो गोल होता है उससे प्रिक करते हैं तो पेशेंट विंच करता है. दिस हेल्प्स टू डायग्नोज अ केस ऑफ सेकेंडरी सिफिलिस. What we call it Buschke-Ollendorff sign. So diagnosis again VDRL almost always positive, because why it is positive and not positive in all cases of syphilis, primary syphilis. Secondary it's positive because it takes 4 weeks to come positive. So once ulceration is there, आपने ये पढ़ा तो था कि it takes 1 to 4 weeks to get the VDRL positive. Secondary तो 4 से 6 हफ्ते हो गए हैं हमें, already 6 to 8 weeks हो चुके हैं. So it's positive, false negative in some cases, false positive in some cases. TPHA may remain reactive throughout the life. So this is the test. Once positive is always positive. This is what we call as Treponema pallidum hemagglutination test. Latent syphilis. Now patient comes to the third stage, that is called latent syphilis. So initial 2 years is primary syphilis, secondary syphilis, early latent syphilis, then the late latent syphilis after 2 years. Persistent seropositivity with clinical sign following resolution of primary secondary lesion occurs and continues as such in 60 to 70%. Less than 2 years is early latent, more than 2 years is late latent. So cutaneous tertiary, what we'll get? So each and every stage of leprosy, stage of syphilis has a very different type of lesion. So first is primary chancre, second you will get rashes and condyloma lata and corona veneris and so many other things. And third is gamma, a deep granulomatous process involving the epidermis secondarily, causes punched out ulceration with white necrotic stuff on the base, lower legs, scalp, face, tunnel. So it's now we are not seeing cases of latent syphilis nowadays because patients usually get the treatment in the primary syphilis stage, early stage, or even secondary. We are able to diagnose and treat. So nowadays, before the advent of penicillin, they used to go into so many stages. After the advent of penicillin and other antibiotics, usually we are not seeing tertiary syphilis nowadays. So it may affect the heart, what we call is cardiovascular syphilis. It may affect the brain, what we call is neurosyphilis. So we will not go into neurosyphilis. आपको primary, secondary याद रह जाए वही बहुत. So coming to the late syphilis, neurosyphilis. So what is the treatment of syphilis? Primary, secondary, early latent we treat by injection benzathine penicillin. So it's a long-acting penicillin which is given 1.2 million units in each buttock. So 2.4 million units are given. So it's not given in the single buttock because it's a thick viscous sort of injection. It is painful. It is given deep intramuscular. So half is given in each buttock. So 2.4 million units intramuscular stat after test dose. So any case of penicillin we have to go for sensitivity testing, or negative test dose should be there before injecting. So this is the treatment for all types of syphilis. Now late latent, usually we go for 3 doses of same injection at 1 week apart. So 3 injections in late syphilis, usually primary, secondary. Nowadays we are going for single injection of benzathine penicillin, 2.4 million units intramuscular feed. Now coming to neurosyphilis, we are not able to give benzathine penicillin. Why? We have to go for aqueous crystalline benzyl penicillin for 18 to 24 million units administered at 3 to 4 million units IV 4 hourly for 14 days. benzathine penicillin क्यों नहीं दे रहे? सब जगह पहुंच गया, not able to penetrate the blood-brain barrier. So penicillin, benzathine penicillin is not able to. Crystalline penicillin can enter, but then it has to be given 4 hourly for 14 days. Other alternatives in patients sensitive to penicillin, we have to go for other regimes. The most common that we are using is doxycycline 100 mg BD for 14 days. Early syphilis 15 days, late syphilis 30 days. कमिंग टू बहुत है आज के लिए, ज़्यादा ही हो गया. Other common, there are so many, it's a long list of STIs that we'll discuss. So the most important commonest was syphilis. And once anybody knows syphilis, he knows medicine. It affects so many systems. It's not just a skin disease. So next time we'll go for